So monkeypox is a virus that's very similar to smallpox. I think a lot of people know historically what smallpox is. And monkeypox has been what we call endemic or local to Africa for some time, with outbreaks over there not uncommon. And what's happened is some of that virus from Africa has been imported into the United States, and we are now experiencing transmission here in the US. So most people are going to get what we call a prodrome. So you kind of start feeling bad a few days before the rash begins. Most people have a fever. You might have swollen lymph nodes. Some people even have a cough or a sore throat along with that. And then a few days later, lesions will pop up, and they're little blister-like lesions that progress and sort of look like chickenpox, but are different. They can be all over. They can be, more focused to one part of the body. But those are the big symptoms that people get. So most people will get a fever and the rash ultimately. Right now in the United States, the majority of individuals that are affected are men who have sex with men. But really our entire population is at risk for this disease. It just so happens that because the main route of spread of monkeypox is through direct contact, that's the population that's experiencing the most disease right now. So most people, when they start feeling sick, it takes about 2 to 4 weeks to run the full course of the disease, okay? So you might start having the fever, the chills, the swollen nodes, and then the rash pops up. And the rash is what's infectious. So it's what has to progress through multiple stages, and then it heals up, and that's when you're no longer infectious. And it's during that time period that those bumps can be particularly painful, especially we're seeing a lot of disease in private areas that are, sensitive to begin with. And so that just sort of adds to their morbidity or the pain that people have. There are effective treatments. The most effective treatment is, hopefully we'll touch on that soon, is called post-exposure prophylaxis with the vaccine. So after you've been exposed, but before you get the disease. But there are medicines that we can use that have been around to treat smallpox. One of those is T-pox, that we can give patients who are really struggling with the disease. They have a lot of diarrhea or very high pain, a lot of painful lesions, and that therapy does exist for us to give it. Most people don't need it.